So thank you everyone. Good afternoon and a warm welcome to our Policy Modeling for Health webinar. I'm Nora So, the Program Manager for Policy Modeling for Health based within Public Health at the University of Glasgow. Policy Modeling for Health is one of 4 consortia funded by UK Research and Innovation as part of its £35 million Population Health Improvement Network. This supports innovative research aimed at tackling the wider determinants of health and reducing inequalities. Our work is focused on developing advanced computational models to help policymakers explore the likely effects of different policy choices on health outcomes and their distribution in society. This is the first of our Policy Modeling for Health Lunchtime webinar series. Each will focus on a different aspect of our consortium activities presented by members of our research team, and all will be pitched at an accessible introductory level and offer participants the chance to ask questions. Recordings of all webinars will be available on the Policy Modeling for Health website. So now I'm delighted to introduce our speaker for today, Dr. Lisa Garnham. Lisa is a lecturer in social policy at the University of Strathclyde, and she is part of the Policy Modeling for Health Appraising Policy Models work package. In today's webinar, she will look to equip us with valuable knowledge and tools that will allow us to appraise policy models confidently. Please feel free to submit questions anytime via the Q&A tab, and we'll come to these at the end of the presentation. Over to you now, Lisa.
Thanks, Nora. So yeah, as Nora said, I'm going to talk you through some work that we've been doing in our Appraising Policy Models work package. It has my name on the slide here, but I should say that the findings of the literature review that I'm about to talk to you about was actually carried out by a team of us. So in that team are Professor Kat Smith at the University of Strathclyde and also Professor Jerry McCartney and Dr. Clemmy Hill O'Connor at the University of Glasgow. So, like I said, I'm going to talk you through the findings of a literature review that we've carried out, and our overarching question for this review was, what makes a good model? In looking for papers for this review, we were very specifically looking for papers that were offering recommendations on good practice and best practice in developing policy simulation models, rather than solely critique of development or use of models. And we were also very specifically looking for papers that were speaking about models that had been deployed in real-world decision-making applications. So not papers that were making recommendations for academic or theoretical development of models, but for real-world applications. So what did this search look like? I'm not going to go into the full detail of what you might see in a Prisma diagram, but because it was a multidisciplinary search that we ran, we had multiple rounds of searches, as you can see in this list. We searched academic databases. We asked our networks for papers that were not academic, so policy-facing papers. We had several rounds of reference list tracing and also used the AI tool Elicit to check whether or not we'd missed anything. The result of that was that there were 36 papers included in the review. What did these look like? Well, there was very little policy-facing literature on the face of it. Most of the papers included were aimed at an academic audience and primarily a modelling audience. They were mainly commentaries. Some included case studies, but they were often single case studies used for illustrative purposes. And there was very little qualitative primary data gathered from the users of models. So if you imagine that if these papers are making recommendations of how to create a good model for policy users, not much of what was included in those recommendations was presented in a way that reflected the views of people who use models. And predominantly the types of models they were speaking about were macroeconomic and climate modelling. There was very little public health modelling beyond healthcare and epidemic modelling. So moving straight on to the findings of this review then, we were looking to synthesize these recommendations from across the 36 papers. And in an overarching way, what they showed is that a good model is one that has transparency, credibility, and utility. And there have been 11 recommendations that we've drawn out from these papers. Those 11 recommendations fall into 2 categories. The first is around model quality, and these kind of underpin whether or not a model is usable by a policy audience. And the second are around the model development process, and these kind of determined whether the model is actually useful. So if you imagine a situation in which you've got a very high quality model that is absolutely usable, if it's not relevant or the development process hasn't brought it close to the policy context, it may not actually be useful to its audience. And vice versa, there may be models that look incredibly useful because they're very relevant, but when you look at the underpinning quality of the model, it turns out that they're not usable. So both of these are required in order for a model to be good, in order for it to be transparent, credible, and useful. So what are these 11 recommendations? I'm not going to talk through these in a huge amount of detail, partly because we have a briefing paper that lays this out quite plainly, but also because we're now under a bit of time pressure because of our technical issues, and it is nice to leave time for questions. So I'll talk through the 11 recommendations briefly and then let you know what we're planning to do next. So in terms of models being usable, this really is the kind of underpinning quality of models, and there are 6 recommendations in this category. First of all, we have model simplicity. So there was an overarching argument across the literature that models should be as simple as possible, but as complex as necessary. Obviously, there's an extent to which this is dependent on the use case of the model. And when we're modeling increasingly complex processes and situations, it does feel like a bit of a tension to say that models should be as simple as possible. The suggestion from some of the literature was that ways of dealing with that complexity might be to build a series of simple models that represent different parts of a complex system, and then using the outputs from those models to make decisions in complex settings. Second on the list, we have data quality, primarily using as high quality data as possible, critically assessing whether or not the quantitative data that is available is actually good enough quality to build models, and dealing with that by either not modeling if the data is not good quality, or finding alternative sources of perhaps qualitative information or data from expert elicitation that could be quantified in order to build models to deal with gaps in data quality. Third on the list, we have model testing. So the obvious verification, sensitivity, and robustness checks that models need to go through. The main point recommendation in the literature from this is that testing should be tailored to model type, obviously, but also the results of model testing should be made available in lay language to anyone who intends to use the model or its outputs. Fourth on the list, we have validation. So validation of model outputs. Obviously, there's the quantitative validation of model outputs, ensuring that they fit within the parameters that have been designed for the model. But there is also an extent to which model outputs need to be validated by model users. Do model outputs look plausible to the people who it is intended to use these models? So there's a quantitative and a qualitative aspect to model validation. Fifth on the list, we have technical compatibility. So ensuring that models are built and designed to be used in ways that are compatible with the software and the hardware that's available to model users. And a big emphasis in the literature in making sure that models can be designed in a way where they can actually be run in the intended host organization, rather than run by a specialist or by a consultant, and then just model outputs being made available. And then sixth on the list, documentation. So the vast majority of literature in this review emphasised documentation as kind of the number one, which begs the question why we put it at number 6. But the reason is that it is the kind of overarching recommendation across all of these is that the assumptions that a model makes, the data that's been used, the testing, the validation, and its technical requirements, they should all be very thoroughly documented. But on top of that, they should be documented in a way that is technical and provides enough information for a technical user. But that documentation should also have versions that are accessible to lay users. If you imagine someone who might be using model outputs or even analyses that have been derived from model outputs, it's important that there are forms of documentation that they can understand if they have absolutely no knowledge of modeling. So this kind of emphasis of different forms of documentation for different audiences or different users of models was a strong theme in the literature. Moving on then to the second set of recommendations from the review, so the things that make a model useful and kind of emphasising its relevance. There are 5 recommendations under this criteria. So these kind of pertain to the model development process. So the first at the top of this list is collaboration. So ensuring that model design and development takes place in a collaborative environment with those who might use models, so that there is two-way dialogue and engagement with policy model users. In the literature, some of the papers that we reviewed also reference the fact that it is important to bring in the views of the public, given that in policy modelling, they are the ones who are impacted by the kind of decisions that are made off the back of models. But this was very much an emerging aspect of the literature, and it wasn't covered by all the papers. But I'll come back to this at the end of the presentation because it's something that we're going to pick up in future work. Second on this list, we have framing and coherence. So acknowledging the role of normative values underlying the assumptions in models, making sure that the language that's used to describe variables or relationships in the model actually reflect those that are understood by those who are intended to use the model. So in some cases, this can be very simple things like variable labels not necessarily being like a string of letters and numbers, but actually being a word that in a common sense way describes what that variable represents. But then there are other aspects, kind of wider aspects of models, like the underlying assumptions that underpin the model. If these don't reflect the assumptions that are held by those who intend to use the model, they're less likely to be adopted by model users because they don't reflect their worldview. In the middle of this list, we have responsiveness. So making sure that the model can be used in a way that is responsive to the policy-making context and that it connects to that context. This can cover a range of things. So for example, how long does it take the model to run? If it takes a week to answer a question, it may be less likely for the model to be used. And this links back to our point about simplicity, but also how responsive are the outputs of the model to the geographies or the time periods that the model user might be interested in. If the model outputs don't go down to small enough geographies or don't run over long enough timeframes, it's less likely to be relevant and useful to model users. Second to last here, we have scrutiny. There was quite a strong emphasis in the literature that models should be scrutinized by someone external to both the model development process and external to those who might intend to use the model. Anyone who's been involved in the collaborative process of building or developing the model is considered to be internal in that respect. And it is valuable to have a process of scrutiny that involves an expert from outside. Those experts may be expert modelers, but they may also be experts in the topic or the policy area that models are modeling. And finally on this list, we have embedding and maintenance. So ensuring that from the start of the model development process, there is a plan, there is scaffolding for kind of maintaining long-term model use. That might be in terms of maintaining the infrastructure that the model requires to run, but it might also mean ensuring that there are, for example, champions within the policy organisation in which it's intended that the model will be used, people who have a very deep understanding of how the model's been developed and who's been collaborated with in developing the model, and making sure that how the model works is communicated through those people to the intended model user. So I've run very quickly through our 11 recommendations there, but you can find more information in our briefing paper. But these together make the quality relevance criteria for policy models that are synthesized from across the literature that we reviewed. So there were a couple of other things that came up through the literature that were not recommendations. The first, or not necessarily the recommendations we were looking for in asking our question. The first was around public participation. So there were a minority of papers within the review who strongly emphasised the need to ensure greater and deeper public participation in the development of models. I'm not going to talk at great length about this, partly because we have an entire theme within policy modelling for health around public participation. This is something that we're attempting to address through the work that we're doing. And my colleague Clemmy Hill O'Connor, who was involved in this review, is part of that theme. And if you're interested in that, you can have a look on our website at the types of work that we're doing. But hopefully there'll be some future lunchtime webinars that will be about that work. But really, this is about bringing not just the perspectives of the public into modelling, but also bringing public scrutiny to modelling as well. The second was around model purpose. So there were a number of papers in this review that described their recommendations for what makes a good model in a way that suggested that actually it depends on what the purpose of the model is. And I'm just going to talk a little bit about that before we finish up. So what do we mean by model purpose? We don't mean in a common sense way in terms of, how is the model used or how a model output's used. The way in which these papers were speaking about model purpose was in what's the kind of underlying function of the model. Is it a model that seeks to predict or anticipate unknown data? So asking questions like, what will happen if we implement this policy and nothing else changes? Or is it a model that seeks to explain plausible mechanisms? So answering questions like, what kinds of processes are behind this policy problem or the implementation of a policy? Or, for example, is it an illustrative model? So a model that seeks to show an idea clearly to an audience who are not familiar with that idea or familiar with those causal processes. And those types of models can answer questions like, what might happen in the distant future if we don't develop an effective policy intervention? And the reason that this was brought out in the literature as being quite important was that the ways in which that we might deploy those 11 recommendations that we've synthesized from across the literature could be quite different depending on the purpose of a model. And I think it is important for us to work through that as we do the next stages of our work, thinking about how are models currently being used in policy. They're often used as predictive, but actually as modeling technology becomes more complex, and we also are modeling more social processes, we might be using models more often to explain or to understand theory. And as we saw during the pandemic, models are now sometimes being used to illustrate or to provide analogies to the public. And what implications does this have for the ways in which we kind of play through our recommendations? Do they look differently depending on model purpose? And that's something that we're hoping to explore later. So coming on to that, our literature review left us with a few questions still to answer. So first of all, as I mentioned at the start, there was very little perspective from model users within the literature. And this kind of left us with a question of what are the views of UK social and economic policy model users on what makes a good model? What are the technical trade-offs between these recommendations, and how are the different elements prioritised by model users? Because we synthesised the recommendations from across the literature, some papers did talk about trade-offs, but only within the recommendations that they were considering in their paper. And we don't really know how the 11 recommendations that we've got might trade off against each other. And thirdly, how well do different model purposes, how well are they understood among model users, and how important is it in ensuring models are used appropriately in policy settings? So what are our next steps? Well, we've completed our literature review, which intended to identify and synthesize what's already known. We're now carrying out some interviews with model users and developers, and using those to build some case studies to explore the use of policy simulation models in the UK, so addressing one of those questions that I mentioned a moment ago. And we also intend later next year to use some workshops with model developers and users to refine our criteria. So the idea is that we'll use the data from our interviews and case studies to make sure that we've captured everything that we needed to, in addition to what we've got from the literature review, and then use the workshops to explore trade-offs and prioritisation as well. So this is the end. I'm just here to say that this work was supported by the UKRI Policy Modelling for Health Consortium. And also, I think Nora has our next lunchtime webinar that she's going to talk to you about just before I disappear. So this is our next webinar being hosted by our colleague Andy, and I'll let Nora tell you a bit about that.
Thanks so much, Lisa. That was very well done. We will have an opportunity for some questions in a minute. So if you have not already submitted your questions, please use the Zoom Q&A tab at the bottom of your screen, and we will get to as many as time allows. Just before that, as Lisa mentioned, we are hosting our next lunchtime webinar on Thursday, the 4th of December, when Dr. Andreas Hon will be explaining synthetic populations, what they are, and why we need them. We hope you can join us then as well. So moving on to the Q&A session. So the first question, Lisa, is this review published anywhere?
Good question, Nora. So we have our briefing paper, which is available on our website, and I think was included in the link to the webinar, but it's also just been submitted to Government Information Quarterly Review. So that will be hopefully published within the next 9 months or so, I hope. But yes, it's under peer review at the minute.
Okay. You touched base briefly on the next phase. Could you expand a bit more on that?
Yeah, absolutely. So what we're doing at the moment is that we're interviewing people from that perspective that was very much missing from the literature. So people who are working in policy organisations or think tanks in a UK setting who have used models, kind of asking them similar questions as to what we asked in the review, which was what do you think makes a good model, but also exploring in depth whether these are aspects of the models themselves or aspects of the model development process. So using that framework that came from the literature review to frame kind of discussions with our interviewees about what they think makes good models. And as part of that, we're exploring whether that differs depending on model purpose, and kind of exploring the different purposes that models are being used in UK policy settings at the moment, Much of the literature that we reviewed was a few years old, and technology is advancing in revolutions at the minute. So getting that up-to-date information from our interviewees is what we're doing. And we're hopefully going to be able to build that into some case studies of different types of models in the coming year. So if anyone who's at this webinar would like to be interviewed for this or is interested in taking part, please do email me and we can add you to our list.
Excellent, Lisa. Maybe we'll wrap up with a final question, as in, so you've listed out the criteria, you've done the review, there are plans to publish and stuff. What would you say about people looking to use the criteria as a checklist?
I think that's challenging. So I think as we carried out the review, there were a number of papers that had over a series of publications developed comprehensive checklists for people who are model developers. So some of these are validation checklists, some of them are testing checklists. Most of them were focused on the kind of technical aspects of models. So the things that you need to make sure that you've done correctly in order to ensure that models are of strong, good quality. And often these checklists were being used in academic publications, but they were also being used to evidence to policy users that actually a procedure had been followed, and it was a valid, a vetted procedure, a peer-reviewed procedure. So as we were reviewing our papers, we didn't want to replicate that. We didn't want to kind of double up the work that had been done on producing very detailed technical checklists, and instead went for kind of broader recommendations on how models might be developed. There was a lot less emphasis on the model development process, so those things about collaboration, framing and coherence and so on. And I think that what we have a lot of potential through the interviews and the workshops that we're going to do to perhaps develop some checklists of things to think about when setting out to develop a model for a policy user, particularly if that's being done collaboratively. So this current round of literature review that we've done hasn't quite got us there yet, but I suspect that there will be some more of a practical tools that might come out of our recommendations as we develop that by gathering a bit more data that's more up to date, but also from a policy user perspective. So that'll give us a much better perspective on actually what kinds of tools would be useful to model users, and kind of help us to figure out what kind of toolkits to develop from there. So yeah.
Lisa. Very closely related to that question is more of an applied sort of question. So from David Walsh, he says, a lot of research has been published recently in relation to health inequalities and relevant interventions in Scotland and the UK, which have used different models. Will you, or can you retrospectively apply this, whether a model is actually a useful assessment, to those like published studies?
Yeah, that's really challenging to do. So that is one of the things that we are hoping to do with our case studies. So you can imagine some of the difficulty in trying to gather data on whether or not a model is considered by its users to be high quality, or the ways in which it might be considered to have been not ideal, but the thing that we needed to use at the moment. I think pandemic modeling is probably the best example of that, in that you have this kind of intersection of the fact that the technology is still developing and our perspective on what good technology was 5 years ago is different than it is now. But also there's the intersection with the policy context. And so a lot of those decisions are very politically loaded. And so it is quite difficult to do that really sensitive research, kind of saying, well, let's look at this specific model and ask the question, was this actually a good model? Should we have made that decision on the basis of that model? And, what could we have done differently? What could we have done better? I think there's an extent to which we're going to attempt to do some of that with our case studies, but I wouldn't like to premise what we're going to find or what we're going to be able to say at this point. But maybe check back to our lunchtime webinar in a year and we might have something more to say on that, is what I'd say.
That's brilliant. Thanks so much, Lisa. I think that's the end of the webinar. So thank you all for joining us for today's webinar and for all your questions. A full recording will be available on the Policy Modeling for Health website next week, along with a link to our briefing paper, What Makes a Good Model. So please do feel free to share with colleagues who were unable to join us today. Thank you again to our speaker, Dr. Lisa Garnham, and thank you to everyone for joining us. Have a great day.
Thanks, everyone.